Hi, I'm Dr. Greg Hall, and I want to give you some perspective on how we developed Vitacode's Sequence Multivitamins. There's a story behind the multivitamin. As many of you know, I wrote the Patient-Centered Clinical Care for African Americans, the first book really for providers, for physicians to talk about the best practices for African Americans. And through that book, I learned a lot. I learned about the best practices for treating hypertension and diabetes and things like that. But I also learned about some specific differences as it relates to the best, as it relates to, vitamin content in people, right? Like African Americans disproportionately have a low vitamin D. We've been hearing about that all through the pandemic. Low vitamin Ds and low vitamin Ds are associated with worse outcomes for this, that, and the other. So, and there's specific differences that are specific to African Americans and things that happen in African Americans that don't happen in white patients or that don't happen in Asian American patients. And so the book was eye-opening, to me, and it sort of led me to say, we need a multivitamin that's specifically for African Americans, right? I also learned that African Americans, and not so much majority populations, tended to have deficiencies or low levels of potassium and of magnesium, right? So just across the population, African Americans tend to have less potassium and less magnesium. And so as a primary care physician, when I do people's labs, I see, oh, so-and-so, your potassium's low, let me put you on some potassium, or eat more bananas. They'll say, I eat bananas, but it's just like, it's a population thing that a lot of people have low magnesium and low potassium. And having a low magnesium and potassium can be associated with higher incidences of heart disease, of heart attacks, of strokes, of peripheral vascular disease or circulation problems. And so, and replacing the potassium and replacing the magnesium is associated with better outcomes, less of those things happening. And so, so that information in the book sort of made me interested in saying, African Americans need a multivitamin that's completely different than the multivitamins that are out there today. Just in general, people with normal vitamin D levels, they tend to have a decreased prostate cancer, decreased colon cancer, less breast cancer, less ovarian cancer, and increased asthma stability. It means their asthma is more stable. Their asthma is good. They have less wheezing, less trips to the emergency room for breathing problems, and increased kidney health. And I don't know if you know that African Americans have far more kidney disease than people of other races or ethnicities. Most African Americans have low vitamin D levels. I mean, that's across the board. That's like 80% of African Americans have a low vitamin D level compared to a very low 30% of the general population. And so that's something that we've all known, but the recommended daily allowance for vitamin D is, for the majority population, is very low. And so we have this one recommended daily allowance, right, when we have all these different populations of people. And so African Americans need a much higher daily allowance of vitamin D. So there was a study that was done that looked at vitamin D and cancer risk and mortality, and that's like the rate of death. And it just said, it simply says, relative to other racial and ethnic groups, African Americans, people of African American ancestry are known to be at higher risk for low vitamin D status, which is what we've already said. And they experience a higher incidence and a higher mortality rates for several cancers. That's what malignancies is, including breast, colon cancer, and prostate cancer. And so again, they question whether, is this low vitamin D related to this increased rate of the cancers in this population, because the differences between the cancers are significant. So African Americans have the highest rates of heart disease, stroke, asthma, kidney disease, colon cancer, prostate cancer, liver cancer, bone cancer. They have the highest rates out of all the races for those diseases. Vitamin C has been shown to increase immune cells. It increases your immune cells are the things that fight off infection. Those are your white blood cells. I mean, it just increases the number so it can do the job better. It also decreases lead levels. And so lead, you've heard about lead poisoning and too much lead in the soil or in the air or in the water. Too much lead can lead to poor development of brain cells and can cause people to be significantly delayed in their advancement. Vitamin C has also been shown to decrease, they call it atherosclerosis, or that's just hardening of the arteries, and that leads to heart attack and stroke. You know, when the arteries get smaller and more narrow, and then if something happens and it gets closed off, if it's in the heart, it's a heart attack. If it's in the brain, it's a stroke. If it's in your big toe, it's an ischemic event, right? And so vitamin C has been shown to decrease that. And it also has been shown to increase uric acid clearing. So one of the thoughts about why do African Americans have increased heart disease, why do they have increased cancer, and one of the theories is that there's increased inflammation. And this increased inflammation has been shown that increased irritation in your blood vessels and in your system has been shown to promote increased heart problems, increased heart disease, increased stroke, and increased cancers. And so these inflammations, scientists are now really putting their attention to, could this inflammation be the reason why we're having this increased disease? And could oppression or racism or stress all lead to increased inflammation? One of the things that we found with vitamins is that vitamin C and vitamin D are associated with less inflammation. And so having a sufficient amount of vitamin D and C, not too much, but just the right amount, will decrease your inflammation and therefore decrease your risk for cancer issues. Now, moving on to folate, we found that having a sufficient amount of folate is associated with increased cardiovascular benefit, and your heart is good, decreased stroke, slow dementia progression if you had dementia, decreased depression, and better outcomes in childbirth. So folate can be very beneficial. Thiamine, known as B1, when that's sufficient, there's decreased kidney disease. And it's also, thiamine is excreted with diuretics, and diuretics is what's used to treat hypertension. And who has an increased rate of hypertension? African American. Vitamin B6 also shows increased efficiency in African Americans. Specifically, having the adequate amount of B6 is associated with decreased heart disease, better hemoglobin is your red blood cells, better your red blood cell function, and increased immune function, which we all need during a time of a pandemic. Having the sufficient amount of B12 is associated with decreased stroke, decreased breast cancer, decreased dementia again, and decreased depression. And so having the right amount of B12 is critical. So one of the really interesting things, and surprising and interesting things I found when researching my book, was that some vitamins can actually be detrimental to your health. And so there was a study many years ago that said that vitamin E was associated with increased what they call all-cause mortality, like that you could die from almost anything, heart disease, stroke, anything, if you were on a vitamin E supplement. They also found that vitamin E was associated with increased prostate cancer. So we know African American men have a substantially increased risk for prostate cancer compared to other racial and ethnic groups. And so, vitamin E associated with increased prostate cancer, my goodness, that can't be good. Selenium, another substance that's consistently in multivitamins, was also shown many years ago to be associated with increased, again, all-cause mortality, right? And also increased prostate cancer. And so there were subsequent studies that showed, well, maybe vitamin E is not associated with increased all-cause mortality. Maybe selenium's not associated with increased all-cause mortality. And then they did another study that said, well, no, it looks like it is. And then another one said, well, maybe it's not. And so there's significant controversy amongst researchers about whether vitamin E and selenium are dangerous for you or helpful or really don't do anything. And I thought, until you guys sort out what you really think vitamin E and selenium does, it's best to leave it out, because we're not deficient in vitamin E or selenium as African Americans, and we certainly don't need any extra, because we might be doing ourselves more harm than good. And when you talk about all-cause mortality, African American males like myself, we have the highest mortality rate, the highest all-cause mortality rate of everyone. And if you look at African American female, they're higher than white females, but they're also, African American females are higher than Hispanic, Latino males and females. So we, as a group that has the increased all-cause mortality, we don't need any vitamins that might accidentally increase our rates of death. We don't need anything to help that, that's for sure. So vitamin K is a perfectly reasonable vitamin, and if you know a little bit about vitamin K, it promotes blood clotting. And so if someone comes in the hospital and has a bleeding problem, we frequently will give them vitamin K to sort of get that reversed. But a lot of the issues that African Americans have with heart attacks and strokes and circulation and peripheral vascular disease, those are all related to blood clots that are forming when we really don't want them to form, right? A blood clot in the heart causes a heart attack. A blood clot in the brain causes a stroke. A blood clot in your leg may cause a ischemic event that may cause an amputation. So African Americans have the highest blood clotting sort of tendency of all races and ethnicities. And so why would you add something that's going to increase that clotting? Why would you give someone a multivitamin that's going to increase something that you already have that's bad? Sequence Multivitamins left out vitamin K because there was no evidence that African Americans needed. Certainly during the time of coronavirus pandemic, it's particularly important to have the adequate amount of zinc in your system, because zinc possesses a potent antiviral effect. It's been proven. There's a lot of cold remedies that are out that contain a significant amount of zinc. And that zinc, if you take it when you think you're coming down with a cold, will on more times than not prevent you from getting the cold, or at least shorten the duration of the cold significantly. A zinc deficiency has been associated with the rapidly increased spread of HIV, of hepatitis C, of herpes, the coronavirus, and of course, the common cold. So during a pandemic, right, you need some zinc to help fight back those viruses that people are sneezing and coughing out. It's also interesting to know that zinc has some other benefits, including those related to diabetes. Now, you may or may not know that African Americans have the highest incidence of diabetes, very high. African American men and women have a much higher death rate from diabetes. So zinc has been shown in a number of studies to reduce blood sugar, right? Your blood glucose, blood sugar, that's the problem with diabetes, and it reduces insulin resistance. And so that's the problem that most type 2 diabetics are insulin resistant. And zinc has been shown to reduce that. It also has been shown to reduce the progression to diabetes for people who have pre-diabetes. And so who knew that zinc can help with a population that has the highest rate of diabetes, African Americans? Zinc has been shown to be helpful, beneficial for both type 1 and type 2 diabetes. Again, zinc deficiency is highest amongst African Americans. And so when I was putting together the formula for Sequence vitamins, I knew I had to put extra amount of zinc in there, because zinc deficiency is highest amongst all racial ethnic groups in the United States. But when you think about why that is, why is zinc deficiency so prevalent? Well, if you look at Africa, Africa is a land it's a very mineral-rich land. The land is full of minerals, diamonds, and iron, and gold, but also zinc and other minerals. The water then, which rinses across the land and waterfalls, and also tends to be very rich in minerals. And so the foods that are grown in the soil that's rich in minerals are also very rich in these minerals. So keep that in mind. So now zinc levels are very high in Africa. The zinc levels in the water are very high. The zinc levels in the soil are very high. And so what happened was Africans developed a type of almost resistance to absorbing too much zinc because their resources were so high in zinc. And so that's sort of been shown in what they call these zinc transporters. And so how you move zinc from outside of the body into the body. And so the loss of the ability to do that has been associated with an increased risk for prostate cancer. So the loss of an efficient way of bringing zinc into the body has been associated with an increased risk of prostate cancer. And so one of the unique features of a healthy prostate is it has the highest amount of zinc in your body. The prostate is the most zinc-rich area in your body, right? And so having that zinc where it's supposed to be in your prostate decreases the ability of your prostate to form a tumor. So the prostate cancer death rate is by far the highest in African American men. Prostate cancer in African Americans is significantly higher than any other racial group. So the fascinating part for me is that the World Health Organization conducted a worldwide cancer study and found that African American men had a 10 times higher risk for prostate cancer than West African men. And we are descendants of West African men, and are 3.5 times more likely to die from cancer. And so that shows that when you migrate from Africa to the United States, you inherit this increased tendency toward a number of diseases, and some of that is related to just the environment. You were genetically engineered to live in Africa with its sun, with its mineral-rich water and soil. And when we displace that into an urban area where we get less sun, where the vegetables aren't as rich, the water isn't as rich in zinc, we then become at a competitive disadvantage in terms of our ability to absorb zinc, which is why we need to get more in the way of supplements. So when I designed Sequence Multivitamins for older adults, African American men and women, I knew I needed to put a significant amount of zinc into the formula so that we'd have at least tried to balance the lack of zinc that we're getting in our environment here in the United States, and hopefully decrease our risk for prostate cancer or for diabetes or for insulin resistance, or decrease our risk for catching infections, for catching colds and pneumonias and coronaviruses and all of those things. So the zinc that's in this formula is designed to specifically address those needs. So our slogan for Sequence Multivitamins, because our needs are different, some of those differences have to do with coming from Africa and the environmental change that we sustained in that dramatic migration, and us having adapted to one environment and now probably in the process of adapting to this new environment, but we may need a little bit of help because we have all these increased risks for diseases left and right. Why would you want more of vitamin E with all the controversy? Why would you want more of vitamin K when we're already clotting more than we should? Why would you want selenium when we've already got the highest rate for for mortality? You wouldn't. And so Sequence multivitamins were devised specifically for African Americans. They give you what you need. They left out what you don't need. They left out when there was any controversy on whether to do this or not. We left that out because they don't need to take that, and there's no deficiency associated with that. Go to sequencevitamin.com, pick out the vitamin that works best for you. I look forward to hearing how you've done on the multivitamin, and please tell your friends. For now, I'm Dr. Greg Hall. So, Sequence Multivitamins by VitaCode, personalized nutrition based on your risks and your genetic makeup, not anyone else's, so that we can finally make an impact on health disparity. Listen, there's a whole lot more information I could share, but for now, suffice it to say, go to sequencevitamin.com and take a look around. I look forward to talking to you soon. Take care.